Determining whether you have an ideal weight depends on various factors, including your age, gender, height, body composition, and overall health. One of the most commonly used methods to assess ideal weight is the body mass index, BMI. A BMI between 18.5 and 24.9 is generally considered to be healthy, while a BMI of 25 to 29.9 is considered overweight, and a BMI of 30 or higher is considered obese. However, BMI does not take into account factors such as muscle mass and bone density, which can be important in determining ideal weight for individuals who are very physically active or have a lot of muscle mass. Other methods to assess ideal weight include measuring body fat percentage, waist circumference, and waist-to-hip ratio. However, it's important to note that these methods also have limitations and should be used in conjunction with other health indicators such as blood pressure, cholesterol levels, and overall fitness level. Ultimately, the best way to determine your ideal weight is to speak with a healthcare professional who can assess your individual health status and provide guidance on achieving a healthy weight that is appropriate for your body type and lifestyle. The waist circumference that is considered healthy can depend on various factors including age, gender, and overall body composition. However, in general, the World Health Organization, WHO, recommends the following waist circumference cut points for adults. For men, a waist circumference of less than 94 centimeters, 37 inches, is considered healthy. For women, a waist circumference of less than 80 centimeters, 31.5 inches, is considered healthy. Having a waist circumference above these cut points may indicate an increased risk for certain health conditions, such as type 2 diabetes, cardiovascular disease, and metabolic syndrome. It's important to note that waist circumference should be used in conjunction with other health indicators, such as BMI and overall health status, to determine an individual's risk for disease. Additionally, waist circumference can be influenced by factors such as body shape, muscle mass, and pregnancy, so it's important to speak with a healthcare professional to interpret your measurements and determine the best course of action for your individual health needs. Having an oversized waist circumference, or abdominal obesity, can be a sign of excess visceral fat, which is a type of fat that accumulates around the organs in the abdomen. Visceral fat is metabolically active and can release hormones and inflammatory substances that can increase the risk of developing a number of health conditions, including type 2 diabetes. Excess visceral fat can interfere with the body's ability to use insulin effectively, leading to insulin resistance and high blood sugar levels. Cardiovascular disease. Visceral fat can increase blood pressure and cholesterol levels, which can contribute to the development of heart disease. Metabolic syndrome. This is a cluster of conditions, including high blood pressure, high blood sugar, and abnormal cholesterol levels, that can increase the risk of developing diabetes, heart disease, and stroke. Sleep apnea. Excess visceral fat can contribute to the development of sleep apnea, which can lead to disrupted sleep and other health problems. Therefore, having an oversized waist circumference can be a warning sign of potentially serious health problems. It's important to speak with a healthcare professional if you are concerned about your waist circumference or if you have other risk factors for these conditions. Visceral fat, also known as abdominal fat or belly fat, can be caused by a combination of genetic, environmental, and lifestyle factors. Some of the factors that may contribute to the development of visceral fat include 1. Poor diet. A diet that is high in calories, saturated and trans fats, and added sugars can contribute to the accumulation of visceral fat. 2. Sedentary lifestyle. Lack of physical activity can lead to weight gain, including the accumulation of visceral fat. 3. Age. As people age, they tend to lose muscle mass and gain fat, including visceral fat. 4. Genetics. Family history and genetics can play a role in the development of visceral fat. 5. Hormones. Hormonal changes, such as those that occur during menopause, can contribute to the accumulation of visceral fat. 6. Sleep deprivation. Lack of sleep can disrupt hormones that regulate appetite and metabolism, leading to weight gain and the accumulation of visceral fat. 7. Stress. Chronic stress can increase levels of the hormone cortisol, which can contribute to the accumulation of visceral fat. Reducing or eliminating these risk factors through lifestyle changes, such as increasing physical activity, eating a healthy diet, managing stress, and getting enough sleep, can help to reduce the accumulation of visceral fat and improve overall health. Reducing belly fat can be challenging, but there are several lifestyle changes that can help. 1. Eat a healthy diet. A diet that is high in fruits, vegetables, whole grains, lean protein, and healthy fats can help to reduce belly fat. Avoid foods that are high in saturated and trans fats, added sugars, and refined carbohydrates. 2. Engage in regular physical activity. Exercise can help to burn calories and reduce belly fat. Aim for at least 150 minutes of moderate-intensity aerobic exercise, such as brisk walking or cycling, per week. 3. Strength training. Resistance training, such as weightlifting, can help to build muscle mass and increase metabolism, which can help to reduce belly fat. 4. Get enough sleep. Lack of sleep can disrupt hormones that regulate appetite and metabolism, leading to weight gain and the accumulation of belly fat. Aim for at least 7 to 9 hours of sleep per night. 5. Manage stress. Chronic stress can increase levels of the hormone cortisol, which can contribute to belly fat. Engage in stress-reducing activities, such as yoga or meditation, to help manage stress. 6. Limit alcohol consumption. Excessive alcohol consumption can contribute to the accumulation of belly fat. Limit alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. 7. Avoid smoking. Smoking can contribute to the accumulation of belly fat, as well as increase the risk of developing a number of health conditions. It's important to note that spot reduction, or targeting belly fat specifically, is not possible through exercise alone. A combination of healthy diet, regular exercise, and lifestyle changes can help to reduce overall body fat, including belly fat.